how do we adopt social media into our benefit, for medical practices. I think of all the various social media choices out there, and I would think that Facebook is probably the best choice, I would guess, as far as trying to do things. And obviously you've got to be very careful, I'm sure, with the HIPAA related stuff and protecting patients' privacy, of course. So why don't you just tell us a little bit about how to go about the social?
So a lot of advertising today is on social media. But if you're really going to run a good digital campaign, you have to have good social channels yourself. And again, this is going back to the foundational aspect of marketing. Before you start spending money on paid search and paid digital, paid social campaigns, you should really have a good organic presence. And you're absolutely right. Facebook is still in 2023 the number one social media channel across the globe. It's almost 3 billion monthly users. And then, going down to things like Instagram, that's fourth, YouTube second. So there's a lot of potential out there. Really, my advice to get a good social media presence is to make a plan, make it easy, and make it somebody's job. And I say it's not that hard, really, to have a social media presence. And for making a plan, you absolutely need to create a social calendar, and you need to commit to doing, I say, a minimum on Facebook of 2 posts per week. So you're really only talking about 8 to 10 posts a month. That's not a lot. But to make that happen, what I really work with my clients to do is to create content buckets. And by a content bucket, it's just a type of content. So I say we're going to come up with 4 different types of content, and we're going to make 2 posts about those a month. And that content could be really simple things, but it has to be things that your audience is interested in. It can't just be, just fluff. So I say if you are in a physician practice, I suggest things like, obviously, you want to feature all of your physicians, at least one a month. You want to have an explanation of each of your service lines once a month. You could do something like, if they're confusing medical terms that you want to explain, that you use in your specialty. That's super interesting. Or a certain diagnosis, or what's on the horizon. There was this kind of drug we're seeing is being tested now. So actually things of substance are what people want to read. And once you come up with 4 or 5 content buckets, then it's easy to come up with a number of posts about them. Then the next thing I say is just make it easy. There are so many free tools out there. I use Canva now for design. You can set up they have all of the social media, the sizes of what the post should be. They're already pre-planned. Canva's free. You create templates, easy to do. And they have free schedulers. There's Sprinkler and I'm thinking Brandwatch, Sochi. And you can schedule out a month. You create 10 of these, schedule them. I try to create 3 to 6 months worth with my clients. And we schedule them all out there. And we don't forget about it because we're seeing what's working, what people are engaging with, and we're putting in, if there's change of hours for a holiday or if there's other things, other more, immediate posts, you sprinkle those in, but you've got your posts already set up ahead of time. So that's make a plan, make it easy. And then my last thing is make it someone's job. And I encourage clients to write into the job description of someone on their staff. And if they absolutely don't have anybody, there are tons of freelancers, tons of agencies, a lot of people who do this.
Mhm.
So I just think it's really, really important that it's someone's responsibility. And of course, as you mentioned, there's certainly HIPAA concerns. You obviously cannot use photographs of any of your clients or any personal information about them without their written permission. And then again, on your social channels, if you are talking about, diagnoses or drugs or terms, I think it's good to have a disclaimer, just like you'd have a disclaimer on your website that says that this is not, medical advice. And those kinds of disclaimers obviously run through your attorney. There's plenty of examples out there, but it's just smart business to do so.
Right. Yeah, that's interesting. So, just a simple example would be, beyond some of the things that you can do all year long, is sprinkle in things that are seasonal. So, we're in Western New York here. I mean, pollen counts, seasonal allergies. Everybody wants to run and get an antibiotic. If you're a primary care doctor, maybe you talk about that. During the cold and flu season, get your flu shot, et cetera, et cetera. So I can see for a lot of different specialties how, there's plenty of things that are relevant and changing throughout the year. And some, you're more affected to in certain parts of the year than others. And, I think that's a good point, though. Like if it's not somebody's job, let's sometimes, in a busy medical practice, that's the last thing that somebody thinks of doing is this. And they've really got to make it a part of their job. So, so that's fantastic, Claire.